to thank Jens for his interesting presentation just before, because it kind of opens the floor to the Health Data Agency work. It's very valuable work on secondary use, so it's nice that we can continue a little bit on secondary use. So just to start with, because we're a very new agency and many people don't know us yet, and just to say why we were creating. So it's many things that were already mentioned today, I think, the European context, which on digital health and health data. It started already much earlier than this, but the first really written text on the Commission, which laid down the floor, opened the floor for the EHDS regulation, was the publication of the Europe Fit for Digital Age as a priority for the Commission. That initiated a lot in 2019, right after the GDPR. Then the EU's digital strategy provided the establishment of the EHDS. And we hope now that the EHDS will soon be assigned. And actually earlier today, we still had a meeting with the Commission, and they said it really, the lawyer and linguistic reading is really nearly finished now, and they will publish in hopefully February 2025. So from that onwards, we will have 2, 4, or 6 years of implementing, depending whether it's primary use, secondary use, and on the specific implementing acts. So ready for that, I think. And of course, there were many other issues, the EU Governments Act and the EU Recovery and Resilience Facility. I think many efforts have been done. It's a lot of work. It's many countries joining all these initiatives. And where are we now? As I mentioned, we hope soon to be in February 2025, so we can finally really start off with using the European health data space. So the Belgian context of that, there's a lot of healthcare data, as it is the same in whole Europe. It's fragmented, it's scattered across organizations and systems. And if I can also refer to the presentation of Jens right before, we also know that the quality is not always the best. And there's a lot of work to be done to integrate all this data at the federal level and to enable secondary use, because that's actually what the EHDS aims to do, is to bridge the gap between primary and secondary use, which enables better healthcare. So, context behind the creation of the HDA. We were actually established by law in 2023. So that's why I started saying that we were a very young agency. We're actually growing very fast. We started with 2 people, then 3 people, and now we're soon being 10. We have a group of, the whole project was initiated by a group of 20 consultants, and we're slowly transferring to an established agency. So, if you see, I cannot see the other ones. Our functions are of course, the HDA is actually created to monitor and to facilitate secondary use in Belgium. But of course, as already clearly said, secondary use is only possible when primary use is really on track. And the HDA tries to bridge that gap as well, somehow, but we also try to bridge the gap between the different federated entities in Belgium to solve the problem of scattered data at different levels within the different agencies at the different levels. So that's why we are. What do we do then actually? Because I've been saying quite a lot on data, and why are we such a young, but with a very agency, but with a difficult task? The HDA aims to facilitate the availability and access to data for secondary use. We aim to support the development and implementation of a policy strategy on secondary use. And in that way, we directly and indirectly want to stimulate innovation and research in Belgium. Yeah, in that sense, to stimulate a data-driven healthcare in Belgium. So in the European context, so I jumped from our agency to Belgium to European context quickly. Of course, we are.
Let's get rid of that.
Yeah, I don't know how to.
I don't know how to close it.
Yeah, I don't know.
Doesn't
Either.
it work? It does. But it's not, if you know how. Which one is? Well, I don't speak French. But
Non,
one of these should make this one here.
désactiver
Franki.
l'invitation pour les autres, masquer.
Masking.
Ah.
Okay, perfect. Much better. Thank actually, with all that being said, that's why the HDA is also appointed as a coordinating agency to implement the European health data space in Belgium. It's our core business at the moment. It's what we are created for, and it's what we are now trying to do. So effective use of health data, that's the main aim of the EHDS. Primary use is mostly done at a different level, but what we try to do is to function as a health data access body, which we will be. We will implement the strategies for purposes for use and forbidden use. There, as you know, there's a limit to the use of secondary data. It's not because we want to open up and have data availability that everything should be allowed. Clearly not. And we will stimulate the use of data permits, secure processing environments, and no identification. So we have a government structure. We will ensure quality of data, infrastructure, and the capacity building together in the EHDS. So how will we do that? And no, this is blocked.
Oh, no.
Put the mouse back in the middle.
It
Okay.
should be here, no? No? Huh? That's.
Okay. So to come back on the HDS, so what is the aim and what will be the HDA being doing there? So the idea is that every person, because this is a try to have a visual on the HDS. So everybody will be able to request data. Even private persons will be able to request health data. There will be a request being done using of every data user will go to an HDAP. It's not decided whether the health data agency will be the single HDAP or one of several. We will anyway be the coordinating HDAP. What will the HDAP do? We will have we will ensure that we can tell you whether the data is available or not. We will support you in finding the data by our catalog, and we will provide the metadata of the data that is available, so you can search for the data. And of course, we will, when the application is done, we will, in collaboration with the data holders, decide whether or not a data access application can be granted, which is then a permit. So it's an independent organization that will now decide whether or not data can be released to a data user, of course, in collaboration with data holders. But that's the core business actually of an HDAP. Of course, together with that, we will discuss the fees that will be needed for that. As you know, health data will not be just available just like that. We want to support also all the data holders. So a fee will be decided together between the data holder and the data and the health data agency, and it will combine both a fee that is asked by the data holder as a small fee for the health data access body, who will be the intermediary person there. Okay, imagine the access is granted. We will not just transfer the data anymore. The HDS obviously and clearly mentions that data should just not be transferred like that, especially when it's on health data, pseudonymized personal data. At anonymized or aggregated level, it's a bit different, but all personal health data that is not anonymized but pseudonymized will be done in a secure processing environment, which means that the health data access body will provide a secure environment. The data holder will push its data into the secure processing environment. The data user will be granted access for certain analysis for a certain period. When this analysis is done, all entry access will be closed. The data will be removed from the secure processing environment and case closed, unless we will ask the results to be published and to be publicly available. Okay, so that's something really new, because now there's a lot of different transfers of data in different ways, different people trying to link in different ways. So that's a big step forward. I think that is initiated by the EHDS, and where the health data access body will have a very central role. Just to state, we're not there yet. As I mentioned, we will be, the EHDS will be signed and published hopefully February, but there's still a lot of technical work being done. We're not there yet, but we still have 2, 4, or 6 years, depending on what, to implement. And in the meantime, there's a lot of research projects going on where also the HDA is involved, like the HDS Health Data at EU pilot project, which is just being, which will close now at the end of the year, which was actually the basic project that published recommendations and is preparing the future work for TEDAS 2, which is a very, very big project with all many of the member states. A joint action program, which is actually preparing the implementing acts. So you don't have only the EHDS, but you have the implementing acts that are joined to the EHDS. What is an implementing act? It will really explicitly explain how things will need to be done. The EHDS is a regulation. The implementing acts will explain and regulate how this will need to be done. There will be implementing acts, €1,500 for that small bit of data. There will be regulations on that. There will be regulations on the secure processing environment. Not secure processing environments will not just be opened like that. There will be security regulation, technical requirements and regulations before they can be used. And that's all examples of regulations, implementing acts that will come out of TEDAS 2. So that's why TEDAS 2 is a very important a project right now in the implementation of the EHDS. And that's why from the Health Data Agency, together with our colleagues from Cienzano, who have a big front runner's role in TEDAS 2, we follow up closely so that we can implement timely to be ready for it. Then, as already explained by Jens, the Quantum project is a very big project, because we don't only talk about just making data available, but the data needs to be of sufficient quality, and it needs to be transparent for data users what the quality of the data is. Because as a data user, you just don't want to order and pay for data for which you don't know, is the data quality high enough to work with to answer your question, your research question or your policy question. And then a new project that is starting in January, where the HDA is also involved together with our colleagues from Cienzano, is the SHAPE-IT project. The SHAPE-IT project will actually support the synergetic implementation of the AI regulation and the EHDS regulation. It's a project that will work on, for example, synthetic data and how it can be used in data modeling and things like that. So how can we use AI in maybe sometimes even avoiding to release all data because we can model data. But that's a project that will start in January. Actually, everything is signed. We will start up in January, but the HDA is very much involved in that project as well. Timeline, as I already said, from the moment that the EHDS is published, and that's expected now, it's a little bit postponed to the beginning of 2025, but now, and it's not the first time that it's postponed, I agree. But I think I notice itself that the Commission is really, really getting a bit impatient themselves. They really want to get off, but we shouldn't underestimate the work that has been done and the impact it will have on data sharing and on data access. And of course, there's so many member states in Europe participating in the HDS regulations that we cannot expect people to be ready in 1 year or another. It takes time. It's not only, of course, the legal aspect. The legal aspects need to be translated in a national law, some of them anyway. Some are very clear. This is EU regulations, but there's also in the HDS many referrals to national laws that needs to be implemented as well. Technical requirements. I talked about secure processing environment, but there's also the connection with the EU central services to be done. There's also data holders to be ready to push their data into secure processing environment. They have to provide the data quality label. So data holders need to be trained in providing the data quality label. So I know it's slow, but it's a big thing. It's a big change in Europe. It's a lot of work to do. And all member states are very motivated to work towards this, and it's a joint action. But we will get there. So just to come back from Europe in Belgium, so I explained the concept why the HDA was created, what we are doing at European level, but how are we working ourselves? I'll quickly jump to it because I think I'm getting a bit out of time. The HDA is not a standalone agency. We've been created by our founding fathers. I'm not allowed to talk about founding fathers anymore, but founding parents. So there's there's the KCE, there's Cinsano, there's the FOD who created us, of course, as an independent agency, and they are still part of the governance board. So everything that is our strategic body. So
Just a translation, FOD is Federal Public
Yeah.
Service and
Yeah.
it's ministry in Belgium.
Yeah, indeed. So they are all part of our governance board, our strategic body. So the HDA in that sense is initiated by them, but they take part of the strategic decisions at management level. That will not mean, because some people already raised concerns like what does it mean with delivery of data permits, etc. Of course, they don't interfere at case level. Below the governance board, we have our user board, which is a very big board, advisory board, and it assists us in the governance of and in fulfilling our missions, because it's a lot of work. We are a new agency, we have to set up. We'll have a big task in leading the whole EHDS implementation. So that's why we have a user board, which is in different working groups. So we ask advice for different participating bodies. Also, for example, from different hospital directors are in it. Pharma.be is in different user boards. So they all support us in giving their idea on getting there together. We work together on the data request procedure. We work together on the international context. We work together on the HDA Academy, which we have, on the secure processing environment, and on our national connection with the central services. I won't go in detail because I'm getting a bit in time in our technical goals, but know that our tasks go from supporting data holders in making their data fair to data access, data maturity, transparency. All our procedures will need to be transparent. All data requests will have to be registered, even if a data permit is not delivered. It should be transparent. Who asked the data? where did he ask it for, why did he ask for, and why was it refused? And HDAP, of course, we will be the coordinating health data access body. We'll have a political role, of course. We will support policy making of secondary use in Belgium, and of course, our management. I will not go into detail on our management plan now, because I think it's not the idea for now. Verification. It's an ugly word, actually, I think, but the fairness of data lies on the basic. What do we do, actually? So we have our metadata catalog, which means that data from the HDS, data holders will be obliged to be opened on which data they have. Yeah, it should be transparent where data can be found. So they will have to push their metadata. The metadata is a description of data, so it's not the data itself, the description of the data. What is in the data, what is the quality will be part of that, will be all to be found in our metadata quality data. So in that sense, it will be easier for everyone to find data, to know what the type of data is. So when you have a specific request, you can go to our metadata quality, you can browse in it, you can search, where can I find this data? It's documented, it's an inventory, and you can search. And of course, our metadata catalog at Belgium level, because we will have a national one, will be connected to the central services. So every metadata record at Belgium level will be pushed to European level. So at the moment in the metadata quality, you can find it. I will give you the link later. We have data from Cinsano, from FAG, from the federal agencies, and from RESIF in it already. We will standardize a request procedure. As said, data will be requested over us. And there will be a different, as I mentioned, between a data access application for personalized and pseudonymized data at individual level. That will be a data access application, and we will also have a data request procedure, which is different, which is for anonymized or aggregated data. So two procedures at different levels. And we will be very transparent, as I mentioned. We will have, at the moment that is not available yet, but we will produce also a web page in which you can find how many requests were handled by the HDA, where have they been granted, what was the time between the data access application and the actual release of the data, etc. When can we expect the reports? Will all be to be found on our dashboard. Secure processing, as I mentioned, the data will not be transferred. Also, the HDA will not, the data will not be transferred to us. We will not manage data. That's actually the role of the Health Data Agency, is to facilitate the transfer of data into a secure process environment. We will not have access ourselves to the data in the secure processing environment, but the links will be granted for data users. We will organize and support and facilitate that so that it's done in a safe and secure environment that we provide. It will be managed by us. So a room will be created for some persons doing an analysis. We will follow up. There will be a monitoring tool in it so that they don't do many other analysis than they have requested for. Data will not be able to, you will not be able to copy data from the secure processing environment. You will not be able as such to transfer access to someone else. It's a personal access. So that will all be managed by the Health Data Agency as a central structure. Cross-border gateways, as you will see, there will be our metadata catalog, which will be linked to at EU level. The data applications will also be transferred at EU level. So also at EU level, we will be obliged to report how our requests are being monitored and how many applications were granted. So that's also all being transferred via a national connector. The secure processing environment, because in case there's a data request coming at EU level, the data will be transferred to a secure processing environment at EU level, so that data coming from different countries will be laid at European level. And that's also a connection that will be done over the Health Data Agency in Belgium. So you see one national connector via the HDA going upwards to the central services. And in the future, there will also be interconnections between different countries, but that's more future. We have an academy in which we have trainings. We foresee trainings for people on how can we make our data fair. There's a training on the EHDS as such. There's training on the health DCAT standards, because data will be, that's something I didn't mention yet. Our catalog will be standardized using the health DCAT language. It's maybe for some of you very technical, but it's a standard that will be used to describe the metadata. And of course, there will be a training also in the HDA Academy on how to apply the health DCAT standards, how to use the editor and things like that. So how can a data holder make sure that this metadata is in the appropriate conditions, and using the exact vocabulary will be also done in there. So you can have a look. There's many trainings already available. We currently working very hard on restructuring our academy. We have a new HDA Academy manager who started 2 weeks ago. So we're very happy to have her. We're expanding our academy as well. So look at the e-learning. We have a communications officer that started yet, because of course we know that communication about EHDS and how it will be done in Belgium and in Europe is very complicated. We want to be very transparent to citizens, of course, and we assure them that actually we all do it together in the benefit for everyone, and we don't do it just to have data being free just like that. But that's a very difficult communication, which will take time. We are currently thinking and discussing on how to bring that to people, how to explain about opting out and the possibilities of opting out, of course. I will not go into detail about that now, but we know that it is a very difficult discussion that we need to handle with care and explain very clearly. So if you want to see more about us, go to our website. And this is our contacts as well. So here I will give you the link again to our website if you want to have a look. I know I was very quick and maybe sometimes a bit chaotic because I wanted to maybe sometimes to move too fast, but that's where we are at the moment, what our goals are and where we are working at.
Yeah, for me at least it was clear.